2:02. We are 2 minutes late to my dismay, but we shall get started. Let's call to order this meeting of the statewide Substance Use Response Working Group, called for January 14th, 2026 at 2 p.m. Again, it is 2:02. Let's take the roll.
Rob Banghart.
Present.
Dave Briggs. Chelsea Cheatham.
Here.
Noelle Shonay.
Present.
Stephanie Cook.
Here.
Assemblymember Edgeworth.
Present.
Attorney General Ford.
Present. Some of y'all get that when you get home.
Assemblymember Goulding.
Here.
Peter Handy.
Present.
Nicole Hicks. Dr. Shayla Holmes.
Present.
Jessica Johnson.
Present.
JC Lance.
Present.
Giuseppe Mandel.
Present.
Kyra Morgan.
I'm here.
Wendy Nelson.
Yes, I'm here. Thank you.
Rosa O'Bannon.
Present.
Dr. Jose Maria Partida Corona. Christine Payson.
Present.
Bud Shaw.
Present.
Steve Shell.
Present.
Senator Jeff Stone. Attorney General, we have a quorum with 18 members present.
Thank you so very much. I notice we have now that our Senate members here. I understand that Senator Doñate has vacated that particular position, and we will be seeking a replacement appointment from the state Senate in that regard. And again, welcome everybody. Hope you had a great new year. Looking forward to a great year on this committee as well. So let's go ahead and move on to public comment. We will be receiving it in person here or at one of our locations where people are gathered. Public comment shall be limited to 3 minutes per person. No action shall be taken on any matter raised under this item of the agenda until the matter itself has been specifically included on an agenda item upon which action may be taken pursuant to NRS 241.021. With that, let me open it for public comment. Is there anyone here in Las Vegas for public comment? Yes, ma'am, go ahead. Please state your name and spell it for the record.
Good afternoon. My name is Jamie Ross, R-O-S-S. I'm the CEO at the PACT Coalition. We found out late last night that our agency would be losing all 3 of our direct SAMHSA funded programs. That's $560,000 in programming directly to our community. I know there are many more who have also lost direct funding. What this means is we will no longer be able to fund after-school programming for our most vulnerable youth, evidence-based prevention programming directly in our schools, and training our community members on mental health first aid to ensure when people experience a mental health crisis, they can help. This affects approximately 15 contractors and 2.5 of our full-time employees. Again, we are one of many. This is just our agency, and I know that there is more to come. We're happy to provide any additional information, and I am hopeful that as this body moves forward with their recommendations, that you prioritize continuing these important programs and ensuring that this work does not get lost while SAMHSA decides if this cut continues. And happy to work with anyone who and explain more privately. Thank you.
Thank you, Ms. Ross. I'm going to offer public comment as well on this issue, but allow me to see if there are others who want to offer public comment before we get to mine. Anyone else here in Las Vegas who wants to offer public comment? Anyone in the Reno office there that wants to offer public comment? Or Carson City, rather?
No, nobody else in Carson City.
Anyone on the screen want to offer public comment? You see anybody? Okay. If you're dialing in from the telephone, the number is 669-444-9171. When prompted, enter the webinar ID 874-4950-7943. Then enter the meeting passcode 168375, and then press *6 so that the host can be prompted to unmute you. My apologies for not reading that earlier. Let's give it a couple of minutes to see if there's anyone on the phone who wants to offer public comment. Do we have anyone on the phone who wants to offer public comment? All right, hearing none, I will offer public comment briefly in regards to the similar matter. Ms. Ross, thank you for offering your comments. On yesterday evening, in almost real time, likewise received notification from individuals indicating that the federal government has canceled contracts that were about to be fulfilled in a couple of days, and effectively immediately wiped out opportunities for services as previously described in public comment. Because this is not an action item, I'm offering this in public comment for purposes of the public to know that the Attorney General's office, my administration, as well as other attorneys general across the nation are reviewing the matter. The understanding is that there have been other efforts to utilize the same CFR, Code of Federal Regulation, to cancel other contracts. And there very well may be litigation that ensues over this issue. So I wanted to offer that in public comment. I'm looking at my counsel to ensure I don't overstep, but just as a matter of public knowledge, this is where the situation is at this moment. Am I okay? I hope. Okay. All right. That's all I'm gonna say. Last call for public comment.
Attorney General Ford,
Yes,
before we
ma'am.
move on, I just wanted to note for the role that Dr. Jose Maria Partida Corona is present today.
Thank you. Thank you so very much. Okay, let's move on to agenda item number 3, a review and approval of our minutes from the October 8th, 2025 SURG meeting. You've received those for review. I will entertain a motion to amend and or simply to accept those.
So moved.
Which one?
Bradshaw.
You want
To accept.
All right. We have a motion to accept. Do I have a second for that motion?
Second,
Who was that? I'm sorry.
Robert Banghart.
My pardon. I should have looked at the screen and said it right there. All right. We have a motion and a proper second. Is there any discussion on the motion? Hearing and seeing none, all in favor say aye. Aye.
Aye.
Aye.
Aye.
Aye. Aye.
Aye.
Any opposed, say nay. Any abstentions? Motion carries. Thank you so very much. Moving on to agenda item number 4, the appointment and introduction of new members, some of which were appointed in October for a term beginning this month in January. I will say the names and allow them to introduce themselves directly. All names will be given at the same time. Dave Briggs, owner of and director of the Clinical Services of True North Treatment Center. Wendy Nelson, executive director, who was again appointed in October for a term beginning in January. Rosa O'Bannon, coordinator of Education Services Division of Clark County School District, who was also appointed in October for a term beginning this month. And Dr. Jose Maria Partida Corona, appointed in October as well for a term beginning this month. And so let's go back to Mr. Briggs and allow you to introduce yourself.
He's not present.
He's not
He's
present.
not present today.
Okay. Ms. Nelson, would you care to introduce yourself?
Yes, thank you so much. So my name is Wendy Nelson. I'm the Executive Director of Frontier Community Coalition. We are a prevention, but also an action agency. And so we cover 4 counties. One we share with another coalition, which is Mineral. So we cover Pershing, Humboldt, Lander, and then we share Mineral County with our partner. And we're very excited that we can be part of this. And so we appreciate it. And yeah, any questions anytime, we're happy to answer, but we're very excited to have the Frontier area represented. So thank you.
Thank you, Ms. Nelson. Welcome to the team. Ms. O'Bannon, would you care to introduce yourself?
Yes, thank you. My name is Rosa O'Bannon. I'm the coordinator for the Department of Safe and Drug-Free Schools within Clark County School District. Our office serves all students, families, staff, and we collaborate with a lot of community partners, a lot of coalitions within our areas, also law enforcement agencies. And so I'm excited to be part of this committee, and I look forward to collaborating in any capacity and providing some insights. I've been in this role for the last 10 years, so I come with a lot of experiences in terms of supporting substance use awareness for youth and families. Thank you.
Thank you, Ms. O'Bannon. Welcome to the team, and we look forward to your contributions as well. Dr. Partida Corona, welcome to the team. Would you care to introduce yourself?
Hi, and thank you, Dr. Partida Corona. I'm a board certified addiction specialist. I was the inaugural class of the fellowship program at Southern Hills Hospital. Since then, I've provided an ambulatory clinic site for that same fellowship program, and I'm here to figure out how we can contribute.
Grateful to have you, sir. Good to see you again, and welcome to the team.
Thanks.
AG Ford, if I
Yes.
can just add.
Yeah, Dr. Kearns?
Terry Kearns for the record. I just wanted to add that Dave Briggs replaces Nancy Lendler, who had the position of person who provides services relating to the treatment of SUD. Wendy Nelson replaces Eric Schoen, and that's a representative of a substance use disorder prevention coalition. Rosa O'Bannon replaces Angela Nichols as a representative of a school district. And Dr. Partida Corona replaces Dr. Dixon as a provider of healthcare with expertise in medicine for the treatment of substance use disorder.
Thank you, Dr. Kearns. Okay, again, welcome to our new members, and we look forward to working with you. Moving on to agenda item number 5, appointment of SURG vice chair, reappointment of subcommittee chairs, and appointment of subcommittee vice chairs. This is for possible action. We'll need to vote on this. And Dr. Kearns, do you want to run through this?
Yes, certainly. As we move forward every year, we look at the vice chair for the SURG and the chairs and vice chairs for the subcommittees. And we have spoken to each subcommittee and to the vice chair, and Vice Chair Steve Shell, who served as the vice chair last year, would be happy to serve again. On the Prevention Coalition, Jessica Johnson is the chair and would be happy to serve as the chair again. And Wendy Nelson has stepped up to act as the vice chair for the Prevention Coalition. For the Treatment and Recovery Subcommittee, we have Steve Shell as the chair, and he would serve in this position again. Currently, we do not have a vice chair for the Treatment and Recovery Subcommittee, so we need to address this issue. If there's anyone who's on the Treatment and Recovery Subcommittee who would like to serve as the vice chair, please say so at this time.
If not, we'll circle back.
Okay, and then for the Response Subcommittee,
Giuseppe
the
Mandel
chair,
for the record. I can step up as vice chair.
Thank you, Giuseppe. Appreciate your volunteer work in that regard.
Thank you, Giuseppe. For the Response Subcommittee, I serve as the chair and will continue to serve, and Dr. Shayla Holmes serves as the vice chair and will continue to serve as the vice chair on the Response Subcommittee.
Thank you, Dr. Kearns. You all have heard the names and the positions for these particular committees and subcommittees. I would like to entertain a motion to approve reappointment of vice chair and appointments of subcommittee chairs and vice chairs.
Stephanie Cook, motion to approve.
Thank you. Can I get a second?
Second.
Great. We have a motion and a proper second. Any discussion on the matter? I'll just say that we have some recurring names here, and I want to say thank you so much for your continued work. Ms. Nelson, thank you so much for jumping in. Giuseppe, thank you for jumping in to help us with this work. You guys have done a great job over the course of the years already. And I'm looking forward to continued great work from you all. So with that, all in favor say aye. Aye.
Aye.
Aye.
Any opposed say nay. Motion carries unanimously. Thanks so very much. Moving on to agenda item number 6, assuming we have Mr. Kruger here, is an update on our opioid litigation, settlement funds and distribution. My Chief Deputy Attorney General, Mark Kruger, who is over our Consumer Protection Division, is on the screen, I believe. And Mark, mic's yours.
That's correct. Thank you, General Ford. Mark Kruger for the record. I am here to just provide an update on the status of the opioid litigation and recovery of settlement funds. The distribution portion of it is primarily handled by DHHS through the Fund for a Resilient Nevada, usually by a separate update from Don Yohe, who runs that program. I think because there's some new individuals on this committee, I'll just briefly overview what the status is of our litigation. We have wrapped up some of the litigation. We still have an ongoing case against pharmacy benefits managers, but to kind of give you where we've gotten with the initial litigation, and we've recovered $1.2 billion. That's the total amount. We did enter into an allocation agreement, intrastate allocation agreement with our local subdivisions, including the counties and litigating cities. That results in a split of those funds, which fund all kinds of programs and services throughout the state to address and mitigate the opioid epidemic. The state amount of that is some $565 million. Now, all of that comes in over a period of time, usually from 2021 until 2020. I think it's 2043. So 2043, we'll see the final amounts coming in, at least as of now. The only thing to update of significance recently, which I believe was on the last one, but with the holidays and everything, I can't recall, but I'll just go ahead and go over it real quickly. That is that we recovered about another additional $8.9 million from various other manufacturer defendants that weren't named in our original litigation. And so that money the settlements for that money is still being worked out, and we anticipate hopefully getting a final document signed and approved by the courts sometime in July of this year. But again, that's just an estimate. But most the agreements and principles have been made. So that pretty much brings you guys up to date on the status of the opioid litigation and the recoveries. I'm here to take any questions that anyone might have.
Thanks, Mark, as always, for the thorough report. Questions, comments from any board members? All right, very well. Thank you so very much, Mark. We appreciate it. We will let you go back to your daily duties of running our Consumer Protection Division. Thanks so much for joining us.
Thank you.
Okay, moving on to agenda item number 7, the update related to surge recommendations from the Department of Health and Human Services and the Nevada Health Authority. This is for information and discussion only. I'm going to turn it over to Laura Hale to have us do this. Pardon me 1 second. All right, very good. Ms. Hale?
Thank you, Chair Ford. Folks should have a handout from the materials posted and in person also available if you want to follow along. So the SURG does make recommendations every year. Of course, this year it's a little bit different with this not being the full annual report. That will come, with new recommendations. So for this annual report that's due at the end of this month, we are just submitting this progress report, basically. And these updates come from various agencies that give us feedback on the recommendations from the SURG. So the first one that you should see on the screen there under prevention, recommending to DHHS and DPBH, well, now it's DHS, Bureau of Behavioral Health, Wellness and Prevention. And that was to increase from the current 12 million in funding to 24 million for this biennium. And so we've got several responses there. And specifically under the Bureau of Behavioral Health, Wellness and Prevention, the funds really come from the federal grants. So the State Opioid Response Federal Grant and Partnership for Success. There's also a SUPTERS federal block grant. There are some prevention general funds, but most of it comes from the feds. And so if you look at that, there were some increases to the funding. Activities increased by 17.84% in federal fiscal year 2026. And then it gives you the amounts for the state opioid response grant. And that's again, federal dollars. So in terms of looking at those options to increase, when you say to increase to a specific amount, the state agency doesn't necessarily have that much control. It depends on how how the federal funding comes forward. With some of the programs, there is state level funding, and you can try to put forward, bill draft request or possibly go through state agency budgeting. But when it's federal dollars, it's maybe a little bit harder for agencies to be responsive because they're dependent on federal funds for that. And just so folks are aware, at the April SURG meeting, we will have someone from Department of Human Services. Christina Hadwick is the Deputy Director for Fiscal Services. So she's agreed to come and present to SURG members to kind of go through the budgeting process with state agencies. So people will have maybe a little better idea of how some of those different funding mechanisms operate. The next item down, create a bill draft request to amend the NRS for 15% set aside of tobacco control. So when the fund, and this is specific to the Fund for Healthy Nevada, when that was originally done in 2000, when the tobacco settlement dollars came into the state, the NRS for our state did set aside different amounts for different program elements. That was changed starting in 2014-15 budget. And so they eliminated those specific program-based percentages. So it's managed in a little bit different manner. And again, maybe there'll be an opportunity to ask questions at the April SURG about how some of those specific funds work, and maybe target some of the recommendations a little better. There is a notice of funding for tobacco services that is available online, and that link will be in the documents. We need to do some updates because we were getting sort of last minute updates from some of the agencies just in the last few days. So we will make that available so you can look at more details that way if you'd like. On the third recommendation, require the State Office of Medicaid to develop a state plan amendment to implement changes to support through recommendation requesting rates and billing standards for community health workers. We got responses from the Nevada Health Authority, Medicaid, that they have a state plan amendment to clarify coverage for peer services and delineate between adult peer recovery support services, family peer support services, and youth peer support services. That was approved in September last year. There's another state plan amendment that will increase peer services rate to $15 per 15 minutes for individual peer services and $3 per 15 minutes for group peer support services. So that's some progress there. Under the Fund for Resilient Nevada, they currently fund Story County for community health workers, but this is a Nevada Health Authority recommendation. And then under the strategic plan, under DPBH, there's some references there to try to support specialists as well. Moving down to item number 4. Create a bill draft request to allocate 15% set aside of cannabis retail funds. Something like that, because so this overall report does go to the legislature, but whether a specific legislator determines to carry a BDR for this is what's going to determine something like that, unless you target that kind of a recommendation to a specific program or agency. And then moving on to the next item under harm reduction, DHS to develop an annual or biannual saturation and distribution plan for overdose reversal medication. The Fund for Resilient Nevada does set aside money for direct purchase. That's currently at $5 million, so pretty substantial investment there. And then under, again, DPBH, let's see, they did develop a preliminary draft of the statewide opioid antagonist saturation plan. And to support progress on the initiative, the team recently onboarded a quality assurance specialist who will begin stakeholder engagement and plan finalization efforts in the first quarter of 2026. And then moving on to item number 2 for harm reduction. Establish statewide initiative for community drug checking that incorporates qualitative and quantitative drug checking and includes the following parameters. So you can see those bullet points there. And then DPBH did respond to this one as well. The Nevada State Opioid Response Grant funded the University of Nevada, Reno School of Public Health to establish a community drug checking and harm reduction initiative in Washoe County. It's called the What the Cut. And that was launched with program elements. And then that same state opioid response program will continue funding UNR for this initiative in federal fiscal year 26. And then moving on to the next item, number 3 under harm reduction, in collaboration with local agencies and through community conversations, DHS to provide for shipping costs for evidence-based harm reduction supplies. So there are a couple of items here. If you look at the bullets there under DPBH, again, the SOR grant funded Impact Exchange, also Track B, to implement the Overdose and Infectious Disease Prevention Expansion Initiative. This program expanded access to harm reduction supplies statewide through vending machines and mail distribution services. And then if you look down at the next bullet, Impact Exchange will continue to receive SOR funding in FFY 26. And then the last bullet, SOR funds the purchase and distribution of naloxone, fentanyl, and xylazine test strips for northern, rural, and frontier Nevada. And then moving on to the 4th recommendation for harm reduction, to recommend a bill draft request to support legislation to help fund and establish a statewide association for peers. The response from Medicaid, they developed a new chapter in the Medicaid manual And that is for peer services specifically. The current minimum age for youth is 18 in policy, but as the service grows, they are hopeful to work with the Nevada Certification Board in the future. And then under the bullet under DPBH, there's a new adjustment that gave that authority around licensing for in-state facilities to DPBH. So we'll look forward to hearing about next steps. And we do, by the way, a lot of the respondents for these recommendations and the progress are with us here today. And so there'll be an opportunity for members to ask questions if you would like. And then moving on to, let's see, treatment and recovery. That first item, legislation should be considered to amend the Nevada revised statutes pertaining to the Nevada Bureau of Healthcare Quality and Compliance, employment guidelines, and this is to do with felony backgrounds on certified peer recovery support and reducing the number of years for that. And so Medicaid currently is working with the provider enrollment team to identify possible exceptions and develop a process to review enrollments on a case-by-case basis, although currently the Code of Federal Regulations does not allow Medicaid enrollment for individuals who have felonies within the past 10 years. So I know that the Treatment and Recovery Subcommittee had looked at this previously and reached out to HCQC about possibly changing some state legislation, but it looks like there may be some federal legislation to be considered. So maybe get some follow-up information in the coming year on that one. And then number 2, for treatment and recovery, support BDR 95 to ensure opioid antagonists must be available on all campuses under NCHE. This has been a tremendous success. Maddie Larson presented to Treatment and Recovery in last year at one of their meetings, and it's been implemented at all campuses at NCHE, and in many cases, they're going beyond what the recommendations specified. So again, a great success on that one. Moving on to item number 3, treatment and recovery support access and linkage for treatment of trauma for people with substance use disorder or those who have overdosed and for surviving family members. And so you can see 3 different programs responded. So Medicaid has allowed for an increase in access to treatment for individuals with trauma with SUD, as well as family members who may need support by allowing mental health treatment within the SUD treatment model. And then under the Fund for Resilient Nevada, they fund the Nevada Opioid Center for Excellence to support training. And then under DPBH, there are a couple of different programs listed there. So Adams Place in Clark County, and there's also a Washoe-based program called Solace Tree, but they're hoping to expand some of that information statewide through a workshop that will be available statewide. And then additionally, there's UNR Project Echo, which does training for professionals. And then down at the bottom bullet, due to the sunsetting of funds from the SOR Third No Cost Extension Award, DPBH is unfortunately unable to continue funding Adams Place, UNR Project Echo, and UNR Espert. So this might be something to look to some of those other resources to see if they could possibly pick up some of that funding. And then moving on to item number 4, direct the Division of Public and Behavioral Health to identify a funding mechanism for hospitals and providers to enhance the bridge program for emergency departments by incorporating peer recovery support specialists into their treatment models. And again, there's a lot going on with the Division of Public and Behavioral Health. And I wanted to just draw down to the second bullet there, the PACT initiative focused on improving emergency department responses to opioid overdoses by integrating peer recovery support specialists into ED workflows, developing protocols. And it's my understanding that Clark County PACT is going to present again, some of this information to a conference that would have statewide attendees and share some of those benefits. And then moving on to the response recommendations on the next page. So that first one, recommending research into implementation of statewide data sharing agreements with the Chief Data Officer of the state of Nevada and implementation of a cross-sector database. So there was apparently a presentation to the response subcommittee from the governor's technology office, and some of that information is summarized there. They formed a data governance committee, which is now meeting regularly. The committee approved a recommendation to adopt a 4-tier data classification framework for the executive branch. In 2026, the committee will begin addressing the technical controls expected for each tier, which will include defining when data sharing agreements are required based on classification level. And then moving on to the second recommendation from the response group, support the collaborative proposal for the Fund for a Resilient Nevada to conduct wastewater sampling of high schools. So this has been a repeating recommendation, and you can see there's been some progress on this. The Fund for Resilient Nevada funds UNLV for wastewater testing, and in 2025, their surveillance program did advance opioid abatement by establishing Nevada's first youth-focused wastewater monitoring system capable of detecting opioid exposure in near real time. And so they work with NSHE to provide public health partners with rapid, unbiased population level data aligned with FRN target area. And the pilot study at Nevada State University generated 55 samples. So again, really good progress with some of that work. And then the second bullet references a parallel upstream monitoring system launched at UNLV and generating approximately 110 samples since January 2025. These micro hotspot insights enabled campus health teams to intensify prevention messaging, consider localized naloxone distribution, and evaluate where drug checking resources might be most needed. And then moving on to item number 3 from response, resolve the conflict between the Good Samaritan Drug Overdose Act and drug-induced homicide law. And there's quite a lot being funded under the Fund for Resilient Nevada there. The Nevada Opioid Center of Excellence is looking at doing a series of social media clips on who the Good Samaritan applies to, what circumstances are covered, and what the limitations are. They're also exploring options for altering the Good Samaritan language to expand coverage to a greater population of individuals living with substance use disorder. And they're working with CASAT at possibly putting together a working group regarding this. Also, DPBH is working on this. They will be supporting a large-scale state-run anti-stigma campaign that will focus on some high-need topics such as MOUD and prevention activities in the schools. Then moving on to item number 4 from response. We didn't get a response at this time, but we'll follow up to see if there are programs and maybe get some presentations in this coming year on those issues. And then on item number 5, recommend state agencies under the legislative, judicial, and executive branches involved with deflection and diversion programs to have a comprehensive definition of recidivism and policies related to measuring and reporting recidivism. The Nevada Health Authority, Medicaid, they hope to gain approval in 2026 on a waiver with requirements that may have definitions established for reporting recidivism, such as they have with the 1115 SUD waiver. And that comes to the end. And as I mentioned, there are various people, some of them now on the SURG, who might be able to answer questions for folks. So I'll hand it back to the chair for that.
Ms. L, I must say, I continue to be impressed with you all and the work that y'all do on this stuff. Very good presentation, very detailed. Thank you for all of this follow-up and the feedback you're giving us on the SURG recommendations. With that, let me open it up to the committee. Questions, comments, concerns, complaints. on what you just heard? See, Ms. Hale, I told you. It was good. Going once, any questions, comments? Going twice? Yeah, go ahead. Who's that?
Sorry, I was going to say, I do see some folks online with questions.
All right, very good. Let's, you want to, who's going to tell me who's up? Okay.
Steve Shaw.
Mr. Shell.
Yes, thank you, Chair Ford. Steve Shelp for the record. I just wanted to add something to what Ms. Hale has brought up today, just for all of us, our fellow committee members to think about as we're thinking about recommendations in the future. But last year, Congress passed H.R. 1, of which Section 71401 established the Rural Health Transformation Program. And in December, the Nevada Health Authority was awarded nearly $180 million for the first year. And this program is designed to mitigate some of the effects of changes to Medicaid financing for the rural hospitals and providers and stand up sustainable solutions to challenges affecting access to care in rural Nevada. And I also wanted to note that SEI will include a link for more information in today's meeting notes. But I just wanted to put that out there, Chair Ford, just something for all of us to be thinking about with this new infusion of funding into the state as we're considering the recommendations going forward. Thank you.
Thank you. Thank you, Mr. Shell. Anyone else on the screen?
This is Wendy Nelson. I
Ms.
do want to
Nelson,
note,
yes,
and yes, thank you so much. For the record, as Steve was mentioning with the rural transformation, there are many of us, I believe that it looks like maybe we can like team up with people to get some of that funding. But not directly apply. And on slide 1, it mentioned PFS, and that is funding that was lost today. So I think that should be factored in as well. Just so you know, that was mentioned in funding, and with all the different funding that was lost, and I don't know with, the different lawsuits that'll be ongoing, that is going to factor in as well. So I just wanted to mention that.
Thank you. Thank you. Okay. Is there, if you have anyone else on the screen, please raise your hand or do your raise hand feature so that we can call on you. No one else? All right, very good. Well, thank you so very much again for the discussion there, Ms. Hale. We appreciate you. We'll move on to agenda item number 8, a review and approval of our annual report. We'll call it a progress report. This is for possible action. We will need a vote on this today. And so let me turn it over to Crystal Duarte to lead us through this discussion.
Thank you, Attorney General Ford. This report is much the same as what you all saw in October in terms of the content, and the content that Laura just reviewed what was updated. So I think you are well informed on that. Because of the changes to legislation governing the SURG, that's why this is serving as a progress report. It does not include recommendations. We wanted members to have more time to develop those recommendations. But a report is required to be finalized by January 30th. So the first part explains the passage of AB 19 and why this report serves as a progress report. There's also information on the working group structure, including the number and types of members and the roles that the Attorney General's office as well as SEI play in helping the SURG function. Based on the review that we did in October, we received feedback from members that we should include links so that people can find information on the SURG, and you'll see there those in footnotes, that those are in footnotes. And the reason for that is these reports do need to be accessible to the public, so we spell those links out instead of just including them or embedding them in the document. The next section of the report talks about the subcommittee structure and shows which of the focus areas detailed in the original legislation have been assigned to each of the subcommittees. And that also explains why they might be working on the types of recommendations that they're working on. I'm going to skip all the way to page 5, which is where we are describing progress in 2025, which just includes documenting the presentations made to the full SURG and the subcommittees. And if you keep going to page 6, you'll see all of the subcommittee presentations as well. And that shows the sense of the direction that subcommittees are going with the recommendations based on the presentations that have been made. And our chairs will be giving an update in the next agenda item to let you know a little bit more about what they're working on in the coming months. Finally, we get to the appendices. Appendix A was reviewed by Laura just now. And then Appendix B is related legislation. The information from the regular session of 2025 was presented in July to the SURG. It has since been updated to include the special session that occurred in November. And any other relevant updates were also made to that section. I'll slow down because I see Mary scrolling through to get to that part of the report. So there you see that beginning on page 25. And then we have a list of the members that served in 2025, including those who stepped down throughout the year. And finally, information regarding opioid settlement funds. That links directly to the Fund for Resilient Nevada's dashboard, which is a very dynamic dashboard that includes information on all of the 7 goals under the Fund for Resilient Nevada and how funds have been allocated since 2023. So with your approval, the Attorney General will sign this, and that's the very last page of the report, and distribute to the appropriate bodies listed on the cover. And I can take any questions or feedback on the report. This is due to be finalized by January 30th. So I would ask that we can turn those changes around pretty quickly if you have feedback today for us.
Thank you. Yet again, impressed. Any feedback, additional revisions? If there are revisions, I'm going to ask that we accept this report and adopt it pending inclusion of any new revisions so that we can meet our deadline of January 31st to get this published. Any additional comments on this though?
Ms. Johnson has her hand raised.
Ms. Johnson.
Hi, everyone. Good afternoon. Jessica Johnson for the record. Hopefully my Zoom is okay. All right. Thank you for all of the preparation to the SEI team and all members of this committee for such great work on compiling the information and the work to produce a report. I'm wondering if and I didn't read the background thoroughly in advance of this meeting, which is my apologies. If the statement that you just said, Crystal, could be maybe really clearly laid out in here, I'm thinking that given that we've done several of these reports, folks might be really looking for those recommendations. I see that you have it like highlighted and underlined. I just I'm wondering if there may be an opportunity with like a brief section header to call out how this is, as you've mentioned, more like a progress report, and that the anticipated report will be forthcoming this year. I think that will be important as people really spend their time in reviewing these recommendations. Thanks for the consideration.
Thank you. Any comments in response?
Yes, that's great. Thank you for that. I think, Ms. Johnson, we can include that in the second paragraph on the first page, noting that a full report with recommendations would be produced by August 1st. I think that is where that might go, if that is what you were thinking.
Yeah, thank you, Jessica Johnson, for the record. I think that would be helpful. While I do see that it's mentioned in here, we've distributed this to a wide variety of colleagues, I know people kind of look through for the recommendations and then maybe go back and read the purpose and background. Maybe that's out of order, but in speaking with folks in community, oftentimes that's how they're reading this. So I would just want to be kind of clear about this as the current status, but a finalized report with recommendations could be expected in August. Thank you for the consideration.
Ms. Johnson, I'm sorry, Crystal, if I can ask a question. I'm actually making notes in the working version of the document, so just to make sure I've documented that correctly. Would it be helpful if there was something perhaps on the table of contents page, like a little call out box? Would perhaps that draw attention to the differences in this report, which I think is what you were alluding to?
Thank you, Jessica Johnson for the record. I think something of that nature, perhaps in a heading calling out this specific change would be helpful to call attention to.
Thank you for the clarification.
Attorney General Ford, Ms. Jonay has her hand up.
Okay, Ms. Jonay.
Yes, Noelle Shanae for the record. Thank you so much for putting together this really amazing report. I know I was able to come in just right there at the very end. So grateful for all the work that came before. As many people, or several, have mentioned in this meeting already, this report does call out a lot of funding that is very insecure at this time coming from the federal government. And I am wondering if it would be worth acknowledging that while this report shares a lot of the amazing progress we have made when it comes to prevention, treatment, recovery, and harm reduction, that many of these programs or funding sources either are at risk and may not be available to continue this work going forward. So thank you for that consideration of an acknowledgement.
You know, you raise an excellent point, I think, certainly worthy of discussion and consideration. It seems to me that maybe there's a footnote that can be dropped that states almost exactly that. And as chair of the committee, I can have my office work with you to develop what that footnote could say relative to the recent developments coming in. Literally, I got notice of this last night at 6 p.m. that people's contracts and grants were going to be cut. And I see the despair on your face. I'm sorry to say it out loud, but I mean, I know I got bad goosebumps right now, Ms. Ross, that y'all are going through some issues right now. So we're going to, I think we should accommodate that. And we will work with you all, Terry. I'm going to have you work with others in my office to help us develop this paragraph or this footnote that can say exactly that. Okay. Any other comments on this? Concerns, suggestions? Okay, I'm going to ask that someone make a motion to approve this report as amended pursuant to this conversation today.
So moved.
I have a motion. Can I get a second?
Noelle Shanae, I'll second.
It's been moved and probably seconded that we adopt this report as amended. Any further discussion on the motion?
Chair Ford,
Yes,
Silverado Ranch Boulevard.
hold one second. Ms. Payson, was that you wanting to speak?
I think it might be Ms. Hale and Ms. Payson was.
Oh, okay. Ms. Hale, go ahead.
I just need to know who made the motion for the minutes. I couldn't see down at the table there.
My bad.
Bud Shaw.
Thank you.
Thank you. Okay. All in favor say aye. Aye.
Aye.
Aye.
Aye.
Aye.
Any opposed say nay. Motion carries unanimously. Thanks so very much. And thank you again for the great work. Okay, moving on, let me, we're gonna call for a 10-minute break right now. We only have a couple more items to go, but I think this next one may take a little bit. So let's come back at 3:05, please. All right, it is 3:05. I'm respectful of folks' time. We will start back up on agenda item number 9, subcommittee reports on presentations and preliminary recommendations for information and discussion only. We've allocated 20 minutes on this. Let's start with Jessica Johnson, Chair of our Prevention and Harm Reduction Group. Ms. Johnson, mic's yours.
Wonderful. Thank you so much, Attorney General Ford, Jessica Johnson, for the record. Really grateful to be here today. On the screen, you'll see kind of a summary of what the Prevention and Harm Reduction Subcommittee has received presentations on over the past year. At our November meeting, we welcomed new Prevention Subcommittee members, Kyra Morgan, Noelle Shanae, and Stacy Lance. We received a great presentation by Stephanie Cook about the state substance use prevention funding through various sources. She offered a lot of great detail on current allocations and had some great insight into the current prevention subcommittee recommendations. The committee also workshopped live some of that language, which was really helpful. The prevention subcommittee, we also reviewed additional recommendations and identified where they currently stand, soliciting new recommendations for the following year. We thanked two subcommittee members who are longstanding members of the SURG and the prevention subcommittee, Eric Schoen and Angela Nichols. The presentations that you see on the screen are ones that have informed our current recommendations. The low barrier emergency department based naloxone distribution, an update on the multi-tiered systems of support project, the Boys and Girls Club of Nevada Alliance, a presentation on naloxone distribution in Nevada hospital emergency departments from the State Board of Pharmacy. And again, as I mentioned, the presentation from Ms. Cook. We're planning future presentation on existing recommendations related to cannabis and tobacco. Our goal is to make them more actionable for any recommendations that we're resurfacing. The next meeting is February 5th, scheduled for February 5th. I think that's all I had in my notes. I'm happy to take any questions at this time.
Thank you, Jessica. Any questions from the committee members? Okay. Great. As always, thank you so much for your hard work, Jessica.
Thank you. Happy to do this work and be part of such a great subcommittee.
Yes, ma'am. Mr. Shell, Chair of Treatment and Recovery.
Thank you, Chair Ford. Good afternoon, everyone. Steve Shell for the record. So regarding treatment and recovery, we also continue to review our progress on prior recommendations, especially due to having several new members on our subcommittee. So that's been helpful to go back and look at our progress and figure out what recommendations we may want to continue to look at and possibly make amendments to in our future recommendations. We did have some great presentations. The first one being from John Hamilton from Connecticut. They've done some tremendous, outstanding work in Connecticut on looking at the outcomes of patients following discharge from detox, as well as examining mortality and overdose. So he really gave us a lot of great ideas, which have led to that being one of our two recommendations that we are currently workshopping. We also had a presentation from John Firestone in Reno. He is executive director of the Life Change Center, and he gave us some great information on the updated regulations for opioid treatment programs that had not been updated in many, many years. So that was very good to hear. And then we heard from our new SURG member, Dr. Jose Maria Pardita Corona. He discussed the trends and opportunities related to substance misuse treatment and gave us lots of ideas to think about that we're also considering. Future presentations that we currently have in mind are looking at the various treatment modalities, as well as continuing our exploration of the retrospective assessment on the outcomes of patients following discharge from detox. We think that's really critical at this juncture in Nevada. And then the one other recommendation that I haven't mentioned that we are currently workshopping is we're continuing to think about how hospitals can be incentivized to provide peer support services in their emergency rooms. It's great, while it's great that Nevada Medicaid is now covering or reimbursing for peer support services, we have lots of other payers who do not reimburse. And so a lot of hospitals, or most hospitals, are reluctant to provide those services, not knowing if they're going to be able to cover their cost. And a lot of hospitals have stood up programs in the past based on grants that were discontinued. So we're, continuing to workshop what that might look like, what our recommendation may look like. But we think that's also something important to consider for the future. And that's it for treatment and recovery. I'll be glad to answer any questions.
Thanks, Vice Chair. Questions, comments from the committee members? Okay, thanks again, Chair Shell, and to the committee for your great work. We'll move on then to our final report from Dr. Kearns, Chair of the Response Group.
Thank you, Chair. The response subcommittee met 5 times throughout 2025 so far. And as with the other subcommittees, we reviewed the progress on our prior recommendations, which thanks to Ms. Hale, you've heard what's been done on our prior 6 recommendations that we had from the last year's annual report. And I did want to just highlight on the one recommendation for the conflict between the Good Samaritan Drug Overdose Act and the drug-induced homicide law is that hopefully you have seen on TV or have heard on radio, PSA, public service announcement funded through the Fund for Resilient Nevada, where it's in both English and Spanish, where we got an actual law enforcement officer and also EMS personnel from up in Washoe County to be involved in those, and about naloxone and the use of naloxone. So I know I've seen them numerous times, so I'm hoping that you all have seen those too. So thanks to the recommendation from the subcommittee and the funding from the Fund for Resilient Nevada. We did have one member leave us, Nancy Lindler, and welcomed new members with new ideas. So thank you for that. We also are looking at, you see the presentations that we've had throughout those 5 meetings. We had 8 presentations throughout those 5 meetings. And future presentations may include from the Division of Public and Behavioral Health on their strategic plan, focusing on the sequential intercept model for diversion and deflection and cross-agency data collection and sharing. We're currently workshopping 2 recommendations and expecting a third. Those 2 recommendations, the first is the prohibit of sale of all psychoactive substances, including hemp-derived cannabinoids and psychoactive mushrooms, to individuals under 21 years of age, aligning with the existing cannabis regulations. The second recommendation, which was also a recommendation in last year's annual report, recommendation number 3, is the recommendation of state agencies under the legislative, judicial, and executive branches with deflection and diversion programs to have a comprehensive definition of recidivism. And we recommend adding desistance to that, and then having standardized policies related to measuring and reporting recidivism. And then our third recommendation that we're considering is that we wanted to find out, first of all, if and what guidance there is when there's prescribing of opiates about what materials are provided. And thanks to Bud Chall, one of our new members, we found out there is FDA language that is required. So that is provided, but also to recommend having safe prescription disposal kits be provided with those opiate prescriptions. So that's something we're still working on, but hope to have as a recommendation for next year. I'll take any questions.
Thank you, Dr. Kearns. Any questions, comments from the committee for Dr. Kearns? Great work as always. Dr. Kearns, I'm gonna leave the mic with you as you go to agenda item number 10 to review and consider.
I'm so sorry. We do have a hand raised online.
My apologies, we missed it. Who we have?
Dr. Partita Corona.
Dr. Partita Corona, go ahead, sir.
Yeah, I just had one quick question, and that's in response to response. Have we talked about perhaps using buprenorphine more commonly as a first-line agent for pain, and trying to disseminate that kind of thought process among our providers rather than going straight to Oxy?
We haven't in our recommendation, and I don't know, that's something that maybe we can coordinate with treatment and recovery as a future recommendation, but thank you for that thought.
Okay, thank you.
Thanks, Doc. We'll give a couple seconds. Any hands come up or any further comments or questions?
I don't see any hands raised or anyone coming off of mute.
All right, very good. Thanks so much, Dr. Kearns. Take us through agenda item number 10, review and consider items for the next meeting.
Yes, currently scheduled for our next meeting, which is April 8th from 2 to 5 p.m. There's a presentation covering peer and prevention specialist certification from Ann Elizabeth Northen at the Center for the Application of Substance Abuse Technologies, also known as CASAT. And also a presentation which you heard from Ms. Hales from Christina Hadwick at DHS on the state budget process and implications for SURG recommendations. We have also requested a status update from Fund for Resilient Nevada on their current status for our April meeting. And I would open it if any members have any other recommendations for presentations for our next April 8th meeting.
Thank you.
Giuseppe Mandel for
Comments?
the record.
Yes, sir. Go ahead, Giuseppe.
I know I'm newer to the treatment subcommittee and newer as appointed SURG, but I mean, I would love to hear some more recommendations regarding treatment. I know you have Mr. Banghart in here. I'd love to hear about their process with treatment with Crossroads and county bed availability and how that's going. I mean, if you've been down to Crossroads, and me and Mr. Banghart work hand in hand, obviously at different facilities, but in the front lines together. And it is an ever growing problem, to get county beds or to get, funds over to a place like Crossroads who serves a valuable asset in the community. And I mean, if you've been down there, I mean, it could use some work. And they service a valuable need. And so, I mean, I'd love to hear about how treatment is going at places like Crossroads or presentations from West Care or even Hickory or one of the newer ones out there that are going to help service the underserved population, as well as some of the private industries in treatment and presentations on where their gaps and pitfalls are, because that's an important part of this. I see a lot of harm reduction and prevention, but we're kind of missing that gap when it comes to the treatment part of it, and the gaps that we have in our state, because it's our state, we suffering a little bit, and we make do, and we help a lot of people, but we can always get better. And I'm sure Mr. Banghart would agree on that, and you as well, Attorney General Ford.
Thanks, Giuseppe. I've seen notes being taken in that regard. Let me say, by the way, you being a new member means, is not an issue you ever have to raise. My fraternity, the diamond is our symbol. And we say among our fraternity members that your diamond shines as bright as anybody else's. And that's the case on this committee. So please, anytime you want to speak up, feel free to do so. Okay? All right.
I just have one other thing. I just wanted to let everyone know that between now and the next meeting, the SURG members will be asked to test and provide feedback on a survey that will be distributed as part of the state's opioid assessment. And after an initial beta test, the survey will be ready for members to take as respondents and share widely with our colleagues. And the SURG will meet again in June, July, and October. And subcommittee meetings for 2026 are expected to be held in February, March, May, June, and September, but that schedule is always subject to change. Thank you.
All right, thank you.
Attorney
Hi.
General Ford, you
Yes,
have a
ma'am.
question, Ms. Johnson.
Ms. Johnson.
Thank you. Jessica Johnson for the record. I am hoping someone smarter than me on this call can suggest when this could happen. I would like an update on the state morbidity and mortality data from 2025 in comparison to previous years. I imagine that might be nearly complete by April, based on other presentations, but I do think as other states have seen a decrease in overdose, and Nevada has remained high, that it be important for this committee to have a pulse on kind of the statewide morbidity and mortality related, particularly to overdose in general, but opioids and other substances of interest. So it sounds, I see Kyra Morgan's hand up. She may have a timing recommendation, but I wanted to add that to the list. Thank you.
Yeah, this is Kyra Morgan for the record. I think April will be a little early for them to have complete numbers for 2025, but we can surely reach out to the Office of Analytics and see if they might want to present preliminary data. We might want to have them come back though at a later quarter, because these are some of the deaths that take longer to quantify. because of age and other factors. So I don't know if I should spearhead that because this is my first meeting as a member, or if I know SEI is organizing. So let me know if it should be me.
It would be great if you could give us a contact who you think we should contact to get that information, if you have one.
Yeah, this is Kyra again. The best way is just to email data@dhs.nv. Actually, it's probably at nvha.nv.gov now. I don't know if the emails have transitioned, so it's either data@dhs.nv.gov, or if they've already migrated it, it would be data@nvha.nv.gov.
Thank you.
Thanks so much for chiming in. Any other hands up?
Stephanie Cook here as well. We do fund those activities, so if you need help, just let me know.
Thank you.
Great. Thanks, Stephanie. Any additional comments? Good.
All good.
Okay. All right. Well, with that, we will move on to agenda item number 11, our second and final opportunity for public comment. Again, it shall be limited to 3 minutes per person. No action shall be taken up any matter raised on this agenda until it has been specifically included on an agenda. With that, let's open it for public comment. Anyone here for public comment in Vegas? Anyone in Carson for public comment? Anyone on the screen for public comment?
Mr. Mandel would like to make a public comment.
Mr. Mandel.
Giuseppe Mandel for the record. Thank you guys all. Apologies for not being there in person today. A little under the weather, but I just want to thank you guys all for the work that you're doing. And you know, I've loosely heard about some of the federal fundings getting cut, and I just wanted to inform some of you that there are, even across the street from where I live, with the land development, there are some philanthropic endeavors that are happening, being put in place. And if you want to reach me offline to set up a meeting with some of those individuals. They are a little bit stricter on their criteria, but not as strict as the federal government. And there are some fundings available where they want to help tackle the program. So there are some good things in place, even though federal funding is getting cut. The city and some of the land developer stuff out here do have ideas and want to be a part of and help with certain funding. So please reach out to me. PAC Coalition is definitely one of them that is on the list for them to meet with. Is one of the first ones for me to meet with. So, and Jamie, give me a call afterwards and we could discuss and setting up a meeting with you guys. And for anybody else that's reach out to me.
Thank you. Any further public comment? Okay, hearing and seeing none, I would entertain a motion to adjourn.
So moved.
I was gonna say, y'all wanna hang out with me a little longer? All right, can I get a second?
Second.
All in favor, say aye.
Aye. Aye.
Any opposed?
Aye.
Motion carries. Thanks so much, everybody. Have a great evening.
Bye, thank you.